Well, certainly the COVID pandemic has interrupted cancer care and screening. We've heard a lot about the concern over a lag in screening. For a time, screenings such as mammography or colonoscopy were completely stopped. And in addition, people weren't going for annual physicals and other kinds of approaches that identify cancer at the earliest stages. So that has been a concern. Secondly, there was a focus on treatment. In the beginning, a great deal of concern about whether cancer treatments could continue during potential exposure to COVID. And then there was the adaptation to continue both radiation and chemotherapy, but to try to limit exposures and interactions within hospital facilities. So our interest in this study was to use a automated system to monitor symptoms at home of cancer patients that we have developed over the years called Symptom Care at Home, and to use it in this particular situation where we wanted to keep symptoms minimized and the patients protected at home and not exposed to potential COVID or other concerns. And also, while the hospital was full taking care of patients and didn't have room for additional patient needs. So what we did was conducted a randomized trial of 128 patients who received the symptom monitoring compared with usual care of 124 patients. And we followed them for 5 months or until they completed their treatment. So all of these patients were on active treatment and were coming and receiving chemotherapy and radiation. And our goal was to see if using the symptom monitoring decreased their need to utilize the emergency department, be rehospitalized, or come in for additional clinic visits. And we also wanted to see, did indeed it decrease their symptom burden? So what we found in the study is that patients who were in the Symptom Care at Home group on a daily basis reported their symptoms related to cancer and cancer treatment. And then they received automated coaching about self-management strategies. So normally what the patient takes home in a flyer of information about symptom management, we provided those tips right as they did the reporting of their symptoms, tailored to their symptoms. Then secondly, symptoms that were of concern, that were poorly controlled, there was an alert to an oncology nurse practitioner who would return a phone call to the patient and try to manage their symptoms and improve the symptom outcomes. And what we found was indeed symptom burden was significantly lower in our intervention Symptom Care at Home group as compared to usual care. We also found that the intervention group, Symptom Care at Home, had significantly less utilization of healthcare resources, and that is clinic visits or urgent care specifically for symptoms, emergency department visits for poorly controlled symptoms, or rehospitalization for symptom control. In the study, we found that participants in the Symptom Care at Home group had significantly less use of these facilities than usual care. I certainly hope that home care and a focus on remote symptom monitoring at home and even care in the home will continue and be mainstreamed after the pandemic. What we have found as sort of silver lining to the pandemic is that the home strategies we've used during this time really are effective, and they're good for patients. Patients prefer to be able to remain at home. They're effective because they're targeted at the time patients really need the care, not until they get out of control and have to seek an emergency department. And secondly, it's good for healthcare because it decreases the burden and demand on emergency departments and cancer facilities that are at capacity in the inpatient setting. And it allows the inpatient setting to be utilized for the diagnostic and acute care initial treatments that they're, rather than having many patients hospitalized because they have poorly controlled symptoms.